what should we do? Should we help her in that? And somebody going, well, if we go up and get a bed from one of those closed units, we're going to be in trouble with the health authorities, because that's just not allowed, because we have to take this step and we have to fill in that paperwork and we have to disinfect the bed and we have to, there's a protocol to follow, which prohibits essentially doing the right thing. But the protocol takes precedence. And that's the kind of society that we're creating. We're creating this society of automatons as opposed to human beings with real human emotions, and just letting their emotions, let people be human and teach them how to manage their emotions so that those emotions are part of the decision-making process. And then you make good decisions and you improvise where it's necessary. So,
Joseph, you talked about before about not being able to legislate away love. Well, let me ask you this. Is it not reasonable to think of, if love is a coin, one side is love and the other side is compassion. Hatred itself is a coin, and the opposite side of hatred is a lack of empathy.
Yeah,
I think that's what we're seeing.
I think that you're probably, there's probably a lot of truth and sense in what you're saying, Nick. I don't know anymore. What
do you say to this? How do you take somebody, shake them by the shoulders, and say, "Do you realize what just happened?"
But you know what the problem here, Nick, is? The problem is there's going to be an inquiry, probably, and there's going to be a set of a new protocol written that takes into account a situation like this. And then a year or a month or 5 years down the road, there's going to be another situation that doesn't fit perfectly into the protocol, but people are going to follow the protocol as opposed to doing what they know is the right thing to do, notwithstanding whatever that protocol is. And you're going to be in the same situation. And God forbid that somebody else should die because of it, but that's the problem that we have these days. It's the rule of the technocrats, as if you will.
You can see it in other areas too.
Sure.
Like when you're driving in the country and you go around a curve, do you know what dictates whether or not there's a guardrail on that curve?
I don't know, but my guess is it has to do with somebody's calculated the inertia based on the speed limit.
Nothing nearly that complicated.
No?
No. Somebody has to die on that curve, and then they'll put a guardrail up.
Oh.
How much sense does that make? What kind of thinking is that? Like, if you have a dangerous curve, and imagine the worst weather you can think of. Either in the summertime, pouring rain, black, deer jumps out, and you're on tires that aren't perfect, and there's no guardrail in a 30-foot drop to rocks. Why wouldn't you put a guardrail there? I'm just using this as an example of a lack of compassion, a lack of empathy for your human beings, because in this case, it's the almighty dollar and the law. The law dictates under what circumstances you're going to put up protective devices to keep the traveling public safe. Same thing, we see this in healthcare, as we've been talking about for the last little while. This is not unique to healthcare. We see it all the time. Like, why do highways, 4-lane highways, have cement dividers? Why weren't they built to keep traffic from slamming into each other at high speeds from across medians right from the very beginning? You can't tell me they didn't know that was going to be a problem. Because somebody ran the cost-benefit analysis and said, oh, well, it's going to be 1.2 deaths per year, and that's not worth the millions of dollars it's going to take to put the guardrail up in the middle.
Well, I hear you, Nick, but all I'm saying, to boil it down to its simplest terms, is that common sense has to trump regulations and protocol. You have to be prepared to use common sense. And, let's go back to your military experience. where the number one thing is to get the job done. And if you can't get the job done following to the letter the protocol that's in place, and because in the military there's whole piles of protocols for any given situation, okay? But you're trained to improvise. You're trained to realize when following the protocol is inhibiting you from accomplishing your mission, and when it is, you throw out the protocol and you improvise.
Well, that's what leadership's all about.
But not in the civilian world anymore, and increasingly it appears not even in the military world.
Yeah, well, I could tell you some stories about that, too, that we don't have time for. But, look, this kind of thing is basically a general decline in people's compassion towards their neighbor. It's because it's the other symptom this is moving away from publicly funded or privately funded local health care in hospitals, okay, where everybody knows the doctor and everybody helps pay that doctor's salary through donations to a particular fundraising effort through that particular hospital. At one time, Pembroke had 4 hospitals. And the health care, now they didn't have the same technology, but, health care was the best they had available at the time. And the people there could hold the people who were administering the hospital responsible. Like if this situation had happened then, there would be riots in the streets and screaming at the hospital saying, if you ever let this happen again, you won't get a dime from this community, and the hospital will make sure that they rectify the problem. But because this is a government bureaucracy with technocrats running it who are removed from the scene and from responsibility, I am not confident at all they're going to put in place anything that's going to allow the flexibility you're talking about.
Well, you could be right, Nick. All I can say is that I guess at this stage is that our thoughts and our prayers are with the family of this poor woman, and all I could say is, again, awful situation, tragic situation, and we can only hope that common sense prevails in future circumstances where the situation is similar. And it's really too bad. It's kind of a sad note to close out this week's show on, but it was an important topic to discuss, and I don't think we've even really scratched the surface adequately on this subject, Nick. I think that there's a lot of soul searching that has to be done, and that we would be producing professionals with so little care for the human being they're dealing with, and so much adherence, so much loyalty, so much mindless loyalty to the system and the various procedures that are in place.
The other aspect of this is people care more about animals than they do about their fellow human being.
Yeah, well, isn't that true? All right, Nick, we're coming up to the top of the hour, so ladies and gentlemen, we appreciate you joining us. It was I think a very interesting show. We touched on a number of important topics, and some perhaps a little bit more important than others, and some more gut-wrenching than others. But that's what we do on the Nick and Joe Show. If you've been listening to us live, thank you very much. If you're listening to us on any of our podcasts, which are just rebroadcasts of this show, please take the time to share them on social media, because we like listeners. Listeners get to listen to our ads, and we're great capitalists. We believe in the free market. We don't charge you to listen to our show. We just ask you to listen to an ad every now and then, especially on the podcast, and that's how we keep the show free for everybody. So with that, Nick, I guess I'll turn it over to you.
We'll see you all again next week. In the meantime, ubiqueritas et amor, Deus ibi est. Good evening, God bless. Don't let anything disturb your peace, and may you have a fair wind and a following sea.